vitamins themselves at 100%, or I do believe that because the diet's not usually adequate and complete is very important. If you're having fat malabsorption, sometimes we have to recommend a multivitamin that is put out for patients with malabsorption of fat. They don't tolerate the they don't consume the fat from the diet because of the fat malabsorption, this steatorrhea, floaty stools. If y'all have that, when I say steatorrhea again, that just is those floaty foul stools that you have. That keeps you from absorbing. That's fat. So you're losing fat vitamins when that's happening. So there's vitamins put on the market for that. Were used in cystic fibrosis for years. One of them is Aqua ADEK. I don't want to just, the most important thing is that you know that you're probably going to need them. Vitamin D needs to be supplemented many times. You need your physician to run your lab, though. You need to know what your baselines are before you start running fat-soluble vitamins. But you only get a vitamin D about every 6 months or so, I think is what we're using. The supplements now, all these other supplements that are over the counter, no, we don't use supplements. We don't use anything individual because many of these things can interfere with chemotherapies. We know St. John's wort and many of these really interfere. So don't recommend any of that really across the board in oncology, not just neuroendocrine tumor areas, but definitely some vitamin, fish oil. Some people use fish oil for heart disease. We know that this is no exception. You're still at the risk for heart disease and metabolic syndrome. I tend to use evening primrose oil, which is another omega-3, which is fine, and I like it. It decreases inflammation, and so does the fish oil. So those are important. If you can absorb those, that's good. I'm fine with vitamin C. I think most of us dietitians, if you give one multivitamin a day, and then if you're having more than 3 or 4 stools a day, may want to put a water-soluble vitamin at the end of the day or as well. So. I do like probiotics. I use probiotics in practice. I don't have a specific name. I have used some through the years, different company names. And there are some of them that have a wider range. They call them super protonics. And those, I've worked with other dietitians that really like those as well. So mostly when we talk about tonics, acidophilus lactobacillus, and so there are some other lactobacilluses, and they can be used as well. But those are something that you don't have to get a name brand. Just get a good. Now, some people like to use the ones that are in the refrigerator section that are powdered, and those are fine. I've used those for off and on myself, and I like them. But I do like probiotics. I think they are important. No, I would no. I don't like any supplements for that kind. I wouldn't know what it is. The problem with supplements, but there's some of this old stuff that they used back with a mushroom that was really toxic, and I sure wouldn't want you to do that. I just don't think supplement. I mean, eat all the mushrooms you want to if it's not upset. I just don't trust supplements. There's no FDA guidance on it. We don't really know what they put into product. So I'm just not an advocate. Some people have, because of the overexpression of serotonin, the tryptophan to serotonin, will have a niacin deficiency.
Okay.
And if you have a niacin deficiency, then we do supplement that. Usually it's 25 to 50 milligrams. I have been in practice for many, 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 many hundreds of years now, and very, very few people are that I've had to put on niacin.
Okay.
But we used to see it more before we got these great treatments. Now we don't see it as often, but I'm not going to say it won't occur. So, it's a plague, but can cause some diarrhea, dementia, dementia things. So it's not that we don't want to keep it in the picture, if something could go on. But niacin can make you flush naturally. So I don't use it alone very often I tend to use it more in combination with other B vitamins. Pancreatic enzyme. Creon is a pancreatic enzyme. It is used and effectively in the patients that it works with for fat malabsorption, if they have pancreatic insufficiency. Pancreatic insufficiency is one of the somewhat of a side effect of these injections because they reduce the amount of pancreatic enzymes that are released in your body. When it reduces, it's a stopper. It's stopping a lot of overexpression, and that's one of them. So if you take a pancreatic enzyme correctly and you take it within 30 minutes of the time you eat your meal, and you take the amount that will help digest that meal, it will usually work in patients that have pancreatic insufficiency. If you're taking it and you're not taking it next to a meal and you're just taking it, that may be one of the problems, is it's just not being taken correctly. So at first I would want to make sure that you were taking it correctly. And the amounts that would be effective. But then you may not be having diarrhea from that. Some people have, if they've had the gallbladder taken out, you'll have a more of a bile salt diarrhea. And it's similar to a for fatty stool, you'll have some of the same, but it's a little bit more of an urgent stool. And sometimes you'll have a kind of a yellow tinge or even a kind of a burning sensation to the rectal area with the bile salt diarrhea. But either way, I would reduce the fat in your diet. We talked about the coconut oil. That'd be a good place to try to use some of the coconut oil. Get off your fried foods. Processed foods have a lot of fats you may not even know are there. We call them hidden fats. They're using, may want to do more home cooking. This is a great time to do that. We're all home. That being said, I think everybody should probably take this time and wisely use this time to do some basic cooking techniques and find about 4 days of foods that you do well with, so you'll always have something for your bad days. So we can try some of these recipes that we have available and that are low fat. Some of them are made for specific, in our sources. And if not, look for things that are some lower in fat overall recipes. And then things that just watch the fibers. I think that's our biggest concern. Things that we consider healthy. I keep getting these terminologies for you, like healthy foods and bad foods or good foods. Well, foods that are healthy for people with normal GI tracts are not necessarily healthy for people that have had surgeries on their GI tracts or having these tumors. Sometimes they can obstruct the GI tract if it's too much fiber, too much raw, cause too much gas. So just because you see it used for the majority of the population as a good food, if it's not good for your body, then you're not absorbing it. It doesn't do well. So we need to use special foods in that case. So, but for him, mostly back off your fats overall, and then find someone that knows a good bit about pancreatic enzymes, pancreatic insufficiency versus bile salt diarrhea. Those would be the two. Because you can take a bile salt binder, I guess there's a medication for the bile salt.
Okay.
You can get a bile salt binder and take that.